Great. Okay. So, as we mentioned in our introductions, we are with the Wisconsin Coalition Against Sexual Assault and Awareness to Action. And today we're going to be talking about some resources that our organizations made in a collaborative effort around child sexual abuse prevention. We'll get into the history of those resources. We'll talk about how to use them. We're just really excited to have you all here. And I will go ahead and get us started by sharing the presentation here, getting us all set. All right, one moment, please, folks. Okay. And I will ask, I know Megan and Laura that you are also co-hosts, so if you don't mind, since my screen is sort of in share mode, if you don't mind making sure that you're able to admit any folks in the waiting room, that would be awesome.
Gotcha.
Okay. Everything look good on your end? Are we good to proceed?
Looks good.
Beautiful. All right. So our objectives for today's webinar, we really hope that after you've spent your morning with us, that you'll be able to walk away with the ability to recognize what qualifies as evidence-based programming, that you'll understand what social norms are and how social norms promotion can either help foster or undermine environmental safety, specifically in terms of preventing child sexual abuse, and discover how our 10 core concepts and the child sexual abuse prevention curriculum review can really help support you in your prevention efforts, both in classrooms and in your broader community. A little bit about WCASA first. We know that we've got a mixed audience today. We're so excited to have folks from both A2A's world, from our world, joining us. If you're not familiar with us, we are a statewide coalition. That means we serve the helpers of the state. So while we don't provide direct service to survivors, typically what we really do is make sure that survivors throughout the state of Wisconsin have great access to wonderful advocacy and prevention around sexual violence. Our vision is a world without violence, oppression, and racism, where all people honor bodily autonomy and social justice. And our mission is creating social change to end sexual violence.
And for those of you who might not be familiar with Awareness to Action, we are a program of Children's Wisconsin. Some of you may know us through Children's Hospital of Wisconsin or some of the clinical services. But at Children's Wisconsin, our vision is that Wisconsin kids are the healthiest kids in the nation. And so a piece of that is through Awareness to Action, we are helping organizations and communities protect children from sexual abuse. So we bring awareness of the issue. We provide education primarily to youth serving organizations on how they can prevent sexual abuse. We engage in advocacy, and ultimately the goal is that all of us are taking actions that will shift the conditions in our world that can keep kids safe. Just to point out, you'll notice under the action section, we say we help adults make decisions. So awareness to action is really centered on adult responsibility and what we have to do as the grown-ups in our kids' world to make sure that they're safe.
Great. So diving into what we're here to discuss today, the tools themselves, the 10 core concepts and the curriculum review, we're going to take some time to first talk about what the tools are, the timeline of how they came to fruition, and why we made these tools in the first place.
So in terms of the curriculum review itself, it is a snapshot of what it takes to keep kids safe from child sexual abuse. The best use of it is to educate yourself and others about child sexual abuse prevention. Through this project, we compared the available curriculum in our state for educating kids on child sexual abuse prevention and safety. One thing to note is that this is a review, so we're presenting a high-level overview of what's available in these curriculum. so that schools can make a comparison and see what's out there. Please note that we do not endorse any specific curriculum or tell you what to choose or what not to choose, but again, really presenting an overview of what's in each of those curriculum that we reviewed. So you might be wondering, I just told you that awareness to action focuses on adult responsibility, adult education. So why are we looking at curriculum centered on educating kids? Well, we recognize that many states are requiring that schools teach kids about child sexual abuse prevention within the school setting. And school folks, you all are wonderful. You do many things. You might not be experts on child sexual abuse prevention, and you might need some support and guidance on picking a curriculum on this topic. There are some websites that provide lists of curriculum that meet certain states' requirements, but every state's requirements are different and every curriculum is different. So, in terms of helping adults make responsible decisions, we wanted to provide a tool so that you all could compare that content and, again, get that high level overview so that you can make a responsible and well informed decision should your school choose or down the road be directed to provide this education within the school setting. So this curriculum review that we're talking about today is actually a version 2. The original review was done in 2019, or I should say it was released in 2019. And since 2019, a lot has happened in our worlds, in our communities, in the fields of sexual violence research. And so we decided it was time to do an update. And so the 2024 update that we're going to be talking about today reflects current research in prevention, principles of health equity, what it means for all of our kids across the state to have the opportunity to be healthy and safe, and really take a look at you'll hear more about the 10 core concepts from WCASA, but really, what does it mean to do prevention in 2025? So in order to do this, we had members of Awareness to Action Steering Committee. I see some of you online. Thanks for being here. So we had folks from various statewide agencies help us to review these curriculum, and they used a scoring tool so that there was some consistency in how we were looking at curriculum. There were 2 to 3 people who looked at each of the different curriculum, compared their notes, and then compiled a summary that you'll see in the actual review. There are 11 different options that you will see in the curriculum review. These were selected because, quite honestly, some of them were on lists that we found online for schools to use in this type of education. But then we had to get our hands on these curriculums, so we selected the ones that were being used in Wisconsin schools and that we had available to us. So we borrowed some curriculum, we purchased some curriculum, some we had already. So again, thank you to our partners who did the review and those of you partners who lent us your lessons so that we could review them. We appreciate you.
And just to give you some background on the 10 core concepts. So the 10 core concepts, WCASA and A2A have a long history of our partnership with one another and our collaborations. And the original 10 core concepts were one of those, one of the products of that collaboration. We worked with A2A and partners that they have on their steering committee, as well as some other statewide folks, to review child sexual abuse curricula and education research. The idea was to try to establish some core concepts, for lack of a better term off the top of my head, some criteria that we can go beyond just saying no in response to in preventing sexual violence. We also wanted to make sure that these were not just, well, we're talking about child sexual abuse, and that means we're often victimization prevention focused. We wanted to make sure that we're still thinking about how when you're training children, you're training tiny adults. You're educating them in the foundations of what they'll use as adults and older youth. So we also have perpetrator focused information in there, and we'll see as we go. In 2024, we decided it was time to do a refresh. There's a lot of research that came out over the last 10 years. Some of the concepts shifted a little bit to update with new research. Some of them are largely the same core piece. The bullet points stayed the same, but the research has been updated with some newer information and really expanded upon some areas that we didn't have as much research before. And we completed this in preparation for the curriculum review so that we had a new updated version. The original curriculum review, we used the original core concepts, which at that point were already a little bit stale, but it's luckily built on really, really firm research. So even at that point, when it was a little stale, it was still stuff that is still absolutely relevant. We didn't really remove anything from the old core concepts. We added to them because as folks that are tapped into research in this field know, our research base has grown so much over the last 10 years.
Well, an important element to understand about the 10 core concepts and child sexual abuse prevention in general is the idea of social norms. I mentioned at the top of today's webinar that WCASA's mission and vision are really driven around social change. We want to create a safer environment for all people. That, of course, includes children, because we believe that in safe, inclusive, affirming environments, when everyone has what they need, right, we can prevent violence. So let's talk about what that means for social norms as a tool towards child sexual abuse prevention and how that really ties into the 10 core concepts. Social norms are the rules or expectations of the behavior within a specific cultural or social group. So they're essentially based on what people believe to be normal, typical, or appropriate. A really common example that people will point to is that when you get into an elevator, the social norm is that everyone turns around and faces the doors, right? We all believe that that's the appropriate, typical behavior of how we're supposed to act in an elevator in a shared space with other strangers, right? Social norms can function as unspoken rules or guidelines for how people are supposed to behave and for how people are expected to behave. People generally follow social norms because they want to fit in with the people around them. So social norms can be a good thing. They can protect us from harm, such as the social norm of wearing a seatbelt, the norm that recycling is a good thing, and they can protect us from violence, such as the greater social norm that harm against others is bad. In general, social norms are mostly influenced by our families and our peers, which can be harmful if the people that we surround ourselves by are making their decisions and their values based on inaccurate or harmful, outdated notions, right? So, for example, if we are surrounded by folks who think that children's consent doesn't matter, then we are more likely to also believe that ourselves, and therefore to behave and conduct ourselves in a way in which we are passive to violence happening against children. Maybe we even come to expect it to be standard, to be normalized, right? Norms like that in which we accept these harmful ideas are going to perpetuate and contribute to the larger problem of sexual violence, including child sexual abuse. So diving a little bit further into social norms and how they connect to the 10 core concepts, this is a graphic that WCASA came up with some years ago to look a little bit more closely at 4 social norms in particular that we see really driving sexual violence, including child sexual abuse. This is not an exhaustive list, right? These are just 4 norms, but they provide greater context for how our social fabric and the expectations and the norms that we hold with each other really contribute to this larger problem of child sexual abuse. So it's important to understand that the influence of social norms on the perpetuation of violence, right? We really want to appreciate that because they can contribute to community level risk factors for both perpetuating and experiencing child sexual abuse. So in many ways, the 10 core concepts for child sexual abuse prevention not only seek to directly challenge harmful norms, such as harmful gender socialization, normalization of violence and power, right? Limited concepts of health and sexuality. We want to replace harmful norms with positive ones, right? So the 10 core concepts are both trying to challenge, interrupt these harmful norms and replace them with positive, protective factors, right? We want to address both perpetration and victimization. We really want to get at that social fabric with our 10 core concepts. So next, now that we've talked a little bit about how these tools came into fruition, why they were created in the first place, let's get into the actual content and the substance of what's in both the review and the 10 core concepts.
Thanks, Sarah. So looking at what you can expect when you open up, it's actually a digital resource when you pull up on your screen this curriculum review. So it starts at the very beginning. You'll see an overview of who Awareness to Action, who we are, what our program is, similar to what you heard me say earlier. But before we dive into the 10 core concepts, or we dive into even the overviews of the curriculum, we want to give you a highlight of what prevention means. Where does prevention happen? Then we'll look at what you should consider before you even start to choose a curriculum. What are the questions you might need to ask yourself or ask about your community? And then we'll get into the overview of each of the curriculum. You'll see a snapshot I'll show you in just a moment that on one page shows all 11 of the curriculum and if they're meeting those 10 core concepts or not. But then we'll go deeper into each of the curriculum summaries so you can see, okay, within these 10 core concepts, here's what's covered, here's what's not, and really get to do that deeper dive. We also include a sample of the scoring sheet that was used to create those curriculum summaries so that you really have a good understanding of how the review was done. Should you have any questions about why content is covered in one area but not another. You'll also get to read about each of the 10 core concepts, which Megan and Sarah will share about in the webinar today. But if you are one of those people who just wants to know more, I'll highlight that we have a whole reference section so that if you want to read the research that was used to put these core concepts together and to do the review, you have access to all of that information as well. So there's really a lot in this curriculum review. And if you're like, oh my gosh, I'm not sure that I'm going to open that up and read all of that today, that's okay. We're going to give you some highlights from each of those sections so that you can start thinking about it. And then when you're ready, dive into the review and read a little bit more. So first, let's talk about what prevention really is. This might be a review for some of you. This might be brand new information for some. So as we think about prevention in general, prevention is what can be done to stop violence from happening. I'll say probably to stop anything from happening, but in our context, we're talking about violence and specifically sexual violence. And there are different points of intervention when it comes to stopping violence. And all of these levels are needed to have comprehensive prevention. Each of them has effective ways to address various aspects of child sexual abuse. And I want to start on the left in the orange with primary prevention. Primary prevention refers to strategies that are taking place before violence and abuse actually ever occurs. It's the strategies that are working to change the conditions in our world that allow violence to happen. Like Sarah was talking about, those social norms, what are the things that exist in the world that are allowing harm to happen to kids? And so these are really proactive strategies that are looking at the problem before it even happens to make sure that it never does happen. And there are ways that as responsible and caring adults and communities, we can make sure that our communities stay safe and supportive for kids and families. And really, this is going to reduce the need for the next two types of prevention, secondary and tertiary. So secondary prevention is using early detection to stop further harm from happening. So you might think about those of us who are mandated reporters. So we are folks who are trying to look for signs or indicators of abuse and stop it from happening, manage disclosures, or know what to do if we discover or suspect abuse. Again, that's a needed piece. And when we think about our kids in the world, I often hear folks say, oh, kids are so resilient. And I'm really, really happy that kids are resilient. They have the ability to overcome some of the most atrocious things in our worlds. And I'm really glad that they can have the ability to bounce back and thrive. And I really want us to keep in mind that that should not be the expectation for our kids, that we should not expect to stop harm that has happened or is happening, and then have resilient kids, that we really want to stop harm from ever happening in the first place. So that's that piece of secondary prevention. Sorry, I'll have you go back 1 second. Let me hit on tertiary prevention, because tertiary prevention is that resilient building piece as well that provides that ongoing support to kids and families that is addressing the impact and the ongoing impact of abuse and violence. So again, things like counseling, advocacy, supportive services, but ultimately we want to decrease the need for those secondary and tertiary strategies. Thanks, Sarah. Now we can go on to the next one. So I want us to think about, where do these prevention pieces happen? And some of us may have seen these nested eggs or circles before. This is an image of the social ecological model, which is used in various places in public health. But the model really shows that for prevention efforts to be successful, there needs to be strategies at multiple different levels or areas of our world. So there's the individual focus, which, as we talk about curriculum for kids to look at prevention, that's an individual strategy. That's something that focuses on what one person might need to do, or a way that they can shift so that prevention happens. However, we know that if we're only using individual strategies, we are not going to have a full, comprehensive picture of prevention, because if there's an individual who is living in a society with otherwise unsupportive structures, it's really not going to be a realistic expectation that prevention happens. So we want to think about what else needs to happen beyond educating kids so that they can be healthy and safe. So when we look at relationships, we want to think about how we're promoting healthy relationships among our young people, among adults and young people, among other adults, because those are really pieces that are going to impact not just the beliefs or social norms that one person has, but how they interact with others. So similarly, we want to think about our communities, where our kids, where our families are spending time, and what needs to happen for prevention in those spaces. So similar to what I just said about relationships, if we have a young person, an individual has been taught about prevention, and now they're in a space, a school that doesn't have policies that prevent child sexual abuse, it's not going to be as impactful. And then societal, like Sarah mentioned, there might be social norms that shows kids that they don't have any autonomy. So they may be sent an individual message that they have bodily autonomy, or they can protect or prevent something from happening. And yet society is sending messages or giving experiences that let them know they don't have that autonomy, or they're not truly in charge of themselves and their bodies and so forth. So I say all of this to remind us that one strategy alone is not enough to keep kids safe. And as we think about whose responsibility prevention is, I would say really there's only one little egg, nested egg circle that directly pertains to children, right? We have that individual strategy, but then relationships, community, and society are largely the responsibility of adults. So I encourage you to think about beyond what we talk about today, what else needs to happen in our communities, in your world, because education for kids by itself is not likely to prevent child sexual abuse in the way that we intend it to. And I will say this is just a brief overview. So if these are newer concepts to you, know that Sarah, Megan, and I would love to talk more about this and unpack some of these topics beyond what's covered in the curriculum. So next in the curriculum review, there's a section on what you need to consider when choosing a curriculum. And the first thing that we'll ask you to consider is if the curriculum is evidence-based, evidence-informed, or theory-driven. So evidence-based meaning that the curriculum is based in robust research, it has a strong theory that supports it, it's been studied to show impact, and those studies have been replicated with large samples. So this helps us to understand that any results or outcomes after lessons are taught are likely the results of having those lessons and that information shared rather than kind of random changes or another factor that's happening in our students' lives. So again, we really want to think about, has this been studied, and has it been studied within the school setting and with the population that we're hoping to share these lessons with? There's other types of evidence. So evidence informed means that these curriculum are based in theory and research, but it's a bit more of a practice informed approach. And maybe those studies weren't able to be done with such a large sample or replicated. So it could mean that there were adaptations to different audiences or populations other than the one that it was initially evaluated with. So this is really telling us that there's promising outcomes, but it doesn't have as much robust research as those evidence-based curriculum. And then that third thing to consider, is it theory-driven? So these types of curriculum have likely not been as rigorously evaluated, but it is based in some sort of theory or logical rationale. So we believe that the curriculum may be effective, but we haven't yet found the impact as we have with some other curriculum. I do want to note, and it's written multiple times within the curriculum review, that at the time of our writing and publishing of this curriculum review, there were no clinical studies that we found that showed a direct correlation between child-focused sexual abuse prevention education and a decrease in victimization. So again, this goes back to that primary prevention or secondary prevention piece. We are not seeing in research that there's that correlation between the education and the prevention or the decrease in victimization. Another piece to consider is, will this curriculum really meet your students' needs? So as I mentioned, you want to see if the studies and the evidence available are from a school setting. That's where you're going to be doing this education if you are a school or if you're doing that prevention education in schools. But you also want to see if there's ability to do ongoing evaluation or adaptation to better meet students' needs. So while we love that evidence-based and those initial studies, we also want to be looking at our specific context and see if learning objectives are being made, or if the learning is sticking with our students and being applicable to those settings. The third point on this slide, things to consider, your students with IEPs. So we chatted with some folks at Department of Public Instruction about how to approach this piece in our curriculum review. And you'll notice that the review does not include any curriculum specifically directed to students with special education services. However, it is important that schools are utilizing the guidance of the students' IEPs to ensure that all students are able to access whatever prevention lessons are chosen by the district. If you do have more questions about that, we would be happy to chat with you and connect you with folks at DPI if that's helpful to you. Okay. More things to consider. You'll notice there's a lot to consider when you're choosing your curriculum. But once it's time to implement a curriculum, there are some additional pieces that you're going to need to ask yourself. First, who is going to be implementing and facilitating these lessons? Are they knowledgeable about child sexual abuse? Have they been trained to deliver the curriculum in a trauma-informed way? Are they prepared to handle disclosures that come up during these lessons? And part of that is, are they prepared and trained to make a report if those disclosures come up? We do know that oftentimes when presenting this type of information and education to kids, disclosures happen because kids might already know that abuse is happening and they are open to sharing that with their classmates and teachers, or they might be discovering for the first time that what has been happening to them is unsafe and abusive and share that in a safe setting. So we really want to be sure that whoever is facilitating is equipped for all of those pieces. And if they're not yet, that they are given the training and support to get to that place before implementing the curriculum. The second piece is to consider what resources are available to implement whatever curriculum is chosen. So this might include the financial resources needed to cover the cost of the curriculum and the staff time needed to present the lessons. Also thinking about time as a resource. How much classroom time do you need to dedicate to fully implement the curriculum? But also think about external resources. As Sarah and Megan shared, they support a network of folks throughout the state who provide prevention education. So consider if you have a local sexual assault service provider agency who you could use to implement and deliver the curriculum. We talked about evidence-based. Will the curriculum really keep kids safe from abuse? So is that one of the outcomes of the research? The fourth piece, does the curriculum represent and include all members of your school community? So is it going to be reflective of your students? How is it going to be made accessible to all of your students? This includes what happens if a student is absent during the lessons. We want to be sure that all of our students have the opportunity to learn this information along with their peers. So what's the plan if they're not there? So what's the plan if parents, students, families choose not to take part in the curriculum? Is there opportunity to provide additional information or education through a different source, through the family, and be sure, again, everyone has that opportunity to learn this information? Included in that, what's the plan for telling adults, telling those parents and caregivers about this prevention strategy and help them understand what's happening in this prevention curriculum and how they can play a part in it, because they're part of that social ecological model. When kids go home, what support will they need? And speaking of support, we want to think about the support that is going to be needed for for our communities. So that's not only for implementing the curriculum, but if students need support after the lessons due to disclosure or due to learning this information, know who to reach out to. And again, I'll shout out WCASA has a great list of all of those local sexual assault service providers on their website. So consider checking that out. So after you have considered these many, many factors, it's time to choose which curriculum you're going to use. And once you understand the context of prevention, looking at this overview will hopefully guide you in the direction that fits your community. So you'll see the curriculum overview, which, like I said, shows all of the 11 curriculum and all of the 10 core concepts. And if those curriculum are meeting those 10 core concepts based on these dots placed in the matrix. So you can take a glance at that, and then if there's some curriculum, you know what, I'm not going to read more about that. Totally fine. If there's some that you want to learn more about, then you can click over to the curriculum summary. In each of the curriculum summary is going to have 4 main parts to it. The first part, you'll see a table that gives some high-level information. Oh, I see someone asked, can I zoom in on the chart? I can't super easily right now, but we will drop a link to the entire curriculum review and you can zoom in and grab everything that you need from there. And if that's not meeting your needs, Matt, you let us know and we will see how we can get that to you a little bit more easily.
Just interjecting quickly to limit confusion because I'm about to put a different link in the chat. I'm just sharing the link to the WCASA map that Laura just mentioned, and then I will share the link to the whole resource.
Perfect. Thank you, Megan. After you look at that overview, wonderful chart, then you'll see all of these summaries with more charts, lots of charts in this resource. But the first piece you'll see marked by the number 1, you'll see the ages that each of the curriculum cover. We'll also note if for some reason we were only able to review one of the age groups, we'll note that in this chart as well. We'll outline if there is evidence or theory base for the curriculum, the number and the length of the sessions, the cost and how you access, if there's facilitator training available, if there's organization-wide training available, if there's already a parent or guardian involvement built in. And I really love this piece, the active learning components. So how are the students going to be learning this information? Do they get to engage with the information or are they learning through listening? And then the final piece in that first section is there an evaluation component? So does the curriculum provide a way to survey students, survey families, and allow schools to continue looking at if it's meeting students' needs or not? In the second piece, you'll see this little light bulb of what's included. So there will be a bulleted list of which core concepts are included or adequately covered within the curriculum. There might be some that are included, but it's not a robust coverage of the topic. So we'll note that. What's included, some brief explanation about that. And then that third piece will point out what is not covered within that curriculum. So the things that might be lacking or are not adequately fully covered. And then finally, in piece number 4, we're going to have some additional notes. So anything that maybe isn't directly related to a core concept or just needs a little extra attention in regard to the curriculum will be in the notes section for each curriculum. This will, we didn't screenshot like any of the direct pages because there's a lot of content in there and we didn't want to overwhelm you. So just want to give you a snapshot of what you can expect. Now I'm going to turn it over to Sarah and Megan to talk about the 10 core concepts and which of those concepts you'll see within the curriculum review.
Thanks so much, Laura. So, as Laura described, the 10 core concepts are included within the curriculum review itself, but it also exists as its own separate resource. So we really encourage folks to use both resources in tandem with each other when making decisions about curriculum selection and implementation. But we also really want folks to utilize the 10 core concepts as its own individual tool to better educate themselves in understanding what primary prevention and prevention opportunities exist for child sexual abuse prevention, and what specific concepts, right, really present meaningful opportunity in terms of strategy, and what different implementation efforts can be made in what areas with what content to really promote and foster genuine primary prevention of child sexual abuse. So, quick snapshot of what the 10 core concepts are. We have healthy sexuality and development, gender socialization, identity affirmation, boundaries, bodily autonomy and empowerment, pro-social behavior and skills, understanding, identifying, and responding to trauma, bystander intervention and adult responsibility, information about sexual abuse, and safety and situational awareness. So the individual resource includes in-depth citations and context for what we mean with each of these 10 individual concepts. And we also include all of our references, all of the research and the evidence and the data that we combed through, read, and pulled to update and inform these 10 core concepts. So when you are looking at the tool itself, you will have access to the citations, all that evidence, all that research, if you want to do some of your own in-depth reading, in addition to the review that we provide. Now, actually looking at these 10 concepts, the first one, right, healthy sexuality and development, what do we mean by that? We want to see folks making sure that their prevention strategies, including curriculum, are teaching anatomically correct terms for body parts to youth, right? That we're using age-appropriate sexual development terms and concepts. We want to make sure that sexual health education is evidence-based and accurate. And we want to make sure that it's always going to support access to reproductive health services and information. What we're really referring to here, right, is that healthy sexuality refers to the ability to express one's sexual thoughts, feelings, attitudes, and behaviors in consensual and enriching ways. So to develop a healthy sexuality, youth have to be provided with accurate information that's age appropriate about their bodies and sexual health. So CSE, or comprehensive sexual education, should be evidence-based, medically accurate, and age-appropriate across the lifespan, evolving to align with the physical, emotional, and social development of youth, adolescent, and teens. I know that we sometimes get questions from folks about what does comprehensive sex education look like for elementary age students? Well, we cover that both in the curriculum review and the 10 core concepts, but that doesn't have to be discussions about pleasure necessarily, but it can be non-sexual examples of what consent and bodily autonomy looks like, right? There's age-appropriate ways to instill the importance and values of healthy sexuality without having to use inappropriate or not age-appropriate concepts, right? We can apply that across the lifespan. Instruction for young children should cover the basic differences between male and female anatomy, right? Provide the correct terminology for their genitals, and social emotional concepts should also be introduced, such as how to interact with their peers respectfully. We also really want to note that it's extremely important for comprehensive sex education to be culturally relevant, inclusive, and properly represent the lived experience of all youth, especially those who are Black, Indigenous, and people of color, who are LGBTQ, or who are part of the disability community. Such representation only strengthens comprehensive sex education as a tool for inclusivity and empathy building, which we know are broader protective factors against sexual violence. Through comprehensive sex education, we not only foster healthy sexuality and development, but we further promote the values of respect, empathy, and affirmation, all of which contribute to those social conditions, those social norms, and that social fabric and environment of a culture of safety, of care, of community care, empathy, and safety for all, which is great for us when we are trying to prevent violence from happening in the first place.
I almost started talking without unmuting myself for a second there. Gender socialization is a really important concept when we're talking about child sexual abuse prevention. This includes challenging gender-based stereotypes, supporting skills and interests outside of traditional rigid gender expectations, discussing concepts of masculinity. While we might not be using that term, but talking about, what it means to be a man, what it means to be a woman, having expansive conversations about gender as well. And fostering an LGBTQ inclusive environment, supporting gender exploration. So much of this was similar in our previous iteration, but it just got beefed up by we got more research, particularly around the LGBTQ inclusion piece. We were going more off theory at that point. We have more research now that kind of really backs us up more. But research here shows that certain beliefs and attitudes related to gender, sex, and sexuality may put an individual at greater risk of perpetration or victimization of sexual violence. And this extends to violence broadly as well. So rigid understandings about masculinity, about what different genders are supposed to behave like, particularly when those concepts around masculinity are rooted in power, dominance, and physical toughness, can lead boys in particular to believe that violence is normal and potentially even a performance of masculinity and showing that they are man enough, that sort of thing. And a fun fact, too, about masculinity and violence is that if you take a step back and look at violence as a whole, not specific to gender-based violence, men aren't just the primary, the largest portion of perpetrators. They're also more likely to be victims of violence and injury as well. Men are more likely to escalate an encounter with an agitated stranger than women are. They are prone to certain risk-taking behaviors, and they're less likely to seek help, all because of beliefs that they have about masculinity. Those concepts are being built in youth. So while we might not be using the term masculinity while we're talking to them, supporting an expansive and healthy understanding of what their gender means to them and how they can express it is really, really foundational. Additionally, there's research that shows that while gender exploration is linked to positive well-being outcomes for youth when it is supported, it's important to note that in our current context of rape culture, in many communities, gender exploration may be met with sexual harassment and abuse. Much of what we normalize as bullying is actually sexual and gender-based harassment and abuse. And this is commonly directed at youth who are defying those gender-based, those rigid gender role expectations by being themselves. So this is a really important concept to recognize here as well. And gender socialization intersects with some of the other concepts. So we'll talk about gender a little more as we go.
That brings up a great point, Megan, that while we have these 10 core concepts sort of listed individually, all of them constantly interact with each other. So you're probably going to hear us referring to boundaries, supporting bodily autonomy, which is reinforced with healthy gender socialization, which is learned about in comprehensive sex education, right? They don't exist in really rigid buckets. We have them identified that way so that we make sure we're being comprehensive in our approach, but they really lean on and intersect with each other, which is on purpose, right? We want our approaches and our opportunities for prevention efforts to be inclusive and wide-reaching and comprehensive. And to also further support Laura's point, one individual curriculum is not sufficient, right? Which is why we have these concepts to identify different opportunities to make sure our strategies are running the gamut from individual curriculum to community and societal level approaches, right? And how can we promote those things, ideally through these concepts. Okay. Anyways, moving on to our next concept. You'll see on the left our updated concept in the latest version known as identity affirmation, and on the right column, what originally appeared in the 2015 10 core concepts. Now, it's not that we lost or removed the idea of intersections of oppression. We still see that as being really central to comprehensive and really, really important to comprehensive primary prevention, is that we need to make sure we are recognizing that sexual violence of any nature is a tool of oppression. So identity and intersections of oppression are really crucial in our prevention efforts. However, with the update, We amended that concept because while we didn't want to lose the ideas of intersections of oppression, we wanted to reorient the 2024 updated around protective factors. So through a literature review, updated evidence, we established that identity affirmation, which is the degree to which all identities and cultures can exist freely, express themselves wholly, and be valued and respected within the broader community, is a really powerful tool of prevention because it stands up directly to the most insidious elements of our dominant culture. So when we actually maintain and celebrate identity affirmation for all community members, all folks, we're really standing up to those harmful norms, that harmful environment that fosters things like white supremacy, sexism, ableism, transphobia, homophobia, the things that we know contribute not only to oppression, but to the perpetuation of sexual violence. So that's what that update was about. It was about expanding that idea, orienting it around protective factors, and really celebrating the diversity of identities and really making sure that all communities and all identities are affirmed and celebrated. Identity affirmation ultimately promotes respect for all cultures, as well as respect for oneself. So for the data, going a little bit into some of the research that we found with this recent update, one study showed that youth who participated in an inclusive emotional capacity building program were more likely to view racial and gender exclusion as wrong. They were also more likely to associate positive traits with peers of diverse racial, ethnic, and gender identities, and to play with those peers. Additional research indicated that youth who held strong heteronormative racist and sexist attitudes or norms that went unchallenged were more likely to express hostility toward their gender and racially diverse peers and to believe rape myths. Furthermore, community connectedness is a really important protective factor against violence, especially for historically marginalized communities, right? We know that community connectedness is really significant. So the opportunity to celebrate one's identity, their cultural practices, and connect with their fellow community members is invaluable, not only for violence prevention, but just overall health equity, well-being, quality of life, right? When you are connected and in affinity with your community, you take care of one another, there's a culture of respect, of care. That's where we see really great prevention opportunities taking root. So one thing that I really wanted to highlight, I have some photos here, at WCASA and in the sexual violence field in general, it's no secret that culturally specific programs are doing the strongest and most impactful prevention work. Culturally specific programs, owned, operated, and led, really serving their communities, are authentically and genuinely engaging with their community members in a way that affirms and celebrates their identities. So I wanted to highlight two of our many amazing local programs, Diverse and Resilient, which serves our LGBTQ community, right? People of Progression, who does some amazing work with Black community and with the larger BIPOC community. We just really want to shout out that what identity affirmation looks like in action is, again, creating those safe affinity spaces, not just with only the specific community members, but to celebrate within the broader community that these identities matter, they have value, their practices are respected and celebrated, because when we promote those ideas, we are more likely, again, to create that culture of care, compassion, and safety for all, and to prevent violence.
No one will be surprised that boundaries are here. Some of the newest research on consent and boundaries builds upon that understanding that we had in 2015. So our bullet points didn't change much here. We're still teaching about touching on a continuum, instructing, teaching youth how to say no and reject unwanted advances, setting and respecting boundaries, and discussing concepts of consent in an introductory way. Youth can begin learning consent at a really young age. Ideally, in a lot of cases, starting off with non-sexual in a non-sexual context. I think most adults of all ages have so much to learn about practicing consent in non-sexual interactions. I feel like a lot of us learned consent as a list of rules to get to have sex or to get to yes, even. Let's take the sexual concept out of it. And maybe they're even pretty good at practicing consent in that context, but they still think it's normal to like try to talk their friend into going to an event with them when that is also coercion. So if we're talking about building a consent culture, we want to start with those non-sexual conversations, and we want to make sure that they really get them before we're even introducing the concept of sex. And when we do talk about sex and touching, we need to be gender inclusive in the way that we talk about consent there. That's one of the big updates to this research, is that we need to make sure that all youth are learning all of the skills that they need. Research shows that a lot of sex ed is heteronormative, meaning that it only teaches about heterosexual intercourse, often only in the context of procreation. That means that if that sex ed also covers boundaries, referring to that heteronormative sexual contact, the youth often walk away with a very heteronormative idea of how consent works. The male partner is the asker, the female partner grants or denies. At its best, this leaves hetero male students unclear on how to set boundaries for themselves, hetero female students unsure how to seek consent and handle rejection, and leaves queer students just completely in the dark. So while it might feel like at least they're getting something, none of these youth are actually getting a full set of consent skills to practice. Additionally, we've seen that the research shows that we need to go beyond the basics with consent, even with younger kids. Grooming behavior and power dynamics are really central to child sexual abuse. And so we need to have conversations beyond good or bad touch, talking about unwanted touch, as well as talking about coercion and power dynamics at a young age.
Very closely related to boundaries, of course, is bodily autonomy and empowerment. Right? Sexual abuse violates a child's safety and well-being, as well as their right to their own bodily autonomy. One way to prevent such abuse is to ensure that our larger, broader community, children and adults alike, especially adults, respect the bodily autonomy of children and uphold a child's right to make decisions about their body. I increasingly see conversations on social media, in my social circles, about not forcing young kiddos to hug their aunties or their uncles, like they see them at holidays, to give kisses when they don't want, to receive kisses from a well-meaning grandma if they don't want to. And that's fantastic. That's wonderful. But we want to continue and carry that conversation into more contexts, right? We want to really hone and emphasize the fact that young people, including littles, have the right to make decisions about their bodies. So some evidence and key points that we found with our updated research. We know that bodily autonomy serves to promote agency, physical and emotional well-being, all of which are really crucial attributes that can help mitigate vulnerability to sexual violence. And adolescents who participated in bodily empowerment programming were more likely to recognize and refuse unwanted sexual contact, seek and give sexual consent, and exercise overall bodily agency. So again, we have updated research to show us that with these concepts really honed and emphasized with young people, they are translating that and understanding that to mean that they have the right to make decisions about their body and to practice that boundary-seeking behavior, really put consent practice and interactions into play in a meaningful way, not just understanding it cognitively, but actually acting on it.
Pro-social behavior and skills is one of my favorites. So social emotional learning skills support so many positive things for youth. And we've been using them in so many different areas for so long when it comes to educating youth and prevention. It's one of the strategies that we really have some of the most established research to back up the strategy. And these are if you're not familiar with pro-social behavior and skills, this focuses on things like teaching communication and problem solving, nonviolent conflict strategies, impulse control strategies, and providing skills and tools for self-regulation. So this one's huge for so many reasons. These strategies help youth be better at understanding, processing, and responding to their feelings and those of others. They also act as a protective factor, building resilience against perpetration through increased impulse control, empathy, and healthy conflict resolution, as well as a protective factor against victimization through reduced impulsive risk-taking behaviors and supporting skills in assertive communication for those rejection skills, that skills in saying no. And these skills also support healing from victimization by providing those healthy coping strategies. So there's this one really touches on primary, secondary, and tertiary prevention in some ways for youth. So it's a really powerful tool in our toolbox. And this is really important when we're talking about CSA in particular, because these healthy coping strategies and the reduction in impulsivity, these are both things that are linked as protective factors for other risk-taking behaviors that are also common in youth that have experienced child sexual abuse. Things like self-harm, substance use, and suicide later in life are all linked back to those skills being a protective factor against those.
Right, our next important one, right, understanding, identifying, and responding to trauma. So some updated data that we have on this, survey research has shown that a large percentage of youth across the country, right, are likely to experience adverse childhood experiences, ACEs, commonly referred to as ACEs. That might not be brand new information, right? I'm sure many of us on this call are familiar with ACEs. What we might not be as familiar with is that chronic exposure to ACEs, including sexual abuse and violence, are really damaging to the emotional development of children, as well as their physical well-being and health outcomes later in life, and really often follows them into adulthood. So that can manifest into physical illness or behavioral challenges. In Wisconsin, 54% of adults who experience more than 4 ACEs before the age of 18 in Wisconsin, 54% of adults who experience more than 4 ACEs are actual survivors of child sexual abuse. Further, ACEs are strongly associated with sexual violence. So emotional abuse early in life becomes a risk factor for both sexual victimization and perpetration, while physical neglect and witnessing family violence are significant risk factors for sexual victimization. So in response to these documented risk factors, skill building around understanding ACEs and trauma is a really important element in prevention. In a 2018 study, a community who attended a trauma-informed training that outlined the potential signs of childhood trauma and demonstrated how to create safe physical and emotional environments for children and families were more likely to have the ability to respond to trauma in the context of both their family and their relationships. I think that's a really great example of both primary, secondary, and tertiary prevention and action there. So we are informing the community at large of how to identify trauma within themselves. We have relationship level intervention, right, when they can better interact with their peers, with their family, and respond in a trauma-informed way, which makes us, right, that much closer to creating a community of care and prevention where we can prevent the trauma in the first place. And if and when trauma is happening, we can identify it and respond to it appropriately.
Do you mind if I'm a diva for a second and ask you to go back to the pro-social behavior and skills? Because I forgot to mention one thing. I forgot to mention my favorite. Forgot to mention my favorite piece of research that I came across in this, which is the connection between pro-social behavior and skills and gender socialization. One of the things that I came across in the research is that there is some research showing that boys in particular have a harder time learning social emotional learning skills, and that toxic masculinity, or those concepts that we talked about, masculinity that is rooted in physical dominance and power and aggression. That's their idea of what it means to be a man. That attitude in particular, they have seen that they have seen a result that social emotional learning strategies are less effective when that belief is still intact. So we really recommend pairing social emotional learning with gender socialization. The relationship between those two concepts is really, really important. Thank you. All right, and then now I will talk to you about bystander intervention and adult responsibility. So bystander intervention is a really popular topic in sexual violence prevention, but we don't talk about it so much when we're talking about child sexual abuse. For some reasons that you might be able to guess related to children. But ideally, we'd like to see age-appropriate bystander intervention skills being taught across the lifespan. So youth should be taught how to play their role in getting help for someone in distress, intervening, creating a safe environment for everyone, noticing when something's unsafe. Those are great skills for them to be learning at that point. In addition to them being able to help in the case of an emergency when, maybe no adults are able to. This also instills a sense of individual and community responsibility for safety that they can carry throughout their life. In most cases, the role of children in intervening in an unsafe situation is going to be getting an adult's attention. It's going to be maybe knowing emergency numbers to call for help, setting off an alarm, calling for help themselves, but their role is to alert an adult or another person with more power to actually address the situation. Children can learn those values in age-appropriate actions, and they should. But it's really critical that we focus on adults when we're talking about bystander intervention here. It's really critical to recognize the role of children in society and the limitation that that places on their ability to actually take action for others. So this is why adult responsibility is really important here. Adults need to take their power to intervene to address abuse against children seriously. Our social norms around children, as we've talked about a little bit, often treat them like property, which can have a chilling effect on adults taking action to keep kids safe. So it's really important for adults to be mindful of the situations they're placing children in, recognizing and responding to warning signs, and interrupting and reporting abuse when they see it. It's important to notice too that bystander intervention is not equally accessible or beneficial to all people. Research shows that people are more likely to take action when they relate to the victim, bringing in this empathy piece again as well. We see this in studies that show that girls are more likely to take action than boys among middle school and high school youth, because the example often uses a girl in the example, or they've been educated already to think of themselves relating more to a victim in a sexual abuse scenario. And there's studies that show that college-aged white women were less likely to intervene when a victim was Black in the exact same scenario that they were given, referring to a white victim. The similar studies have shown that educators and other adults may perceive Black youth as less vulnerable or innocent, as well as other youth of color. So knowing this, it's really important that our bystander intervention addresses biases directly. Schools and communities should also be considering the power dynamics that children experience in their space. If you're encouraging children to act as bystanders, you should think about if the space that they're in actually empowers them to engage in those actions.
All right, our next concept is pretty intuitive, right? Information about sexual abuse, because if we want to prevent child sexual abuse, we need to be able to recognize it and to understand it. So, unfortunately, a lot of myths persist about sexual violence in general, and child sexual abuse is no exception. Contrary to the stranger danger narrative that I know I was raised with in the 90s, 93% of childhood sexual abuse is committed by a person who is well known to the child, such as the family member, coach, or friend. This reality directly conflicts, again, with that common rape myth that child sexual abuse is an issue of stranger danger. Demonstrative of this, one study found that observers perceived child sexual abuse victims as more credible when they were assaulted by a stranger compared to a family friend. So we have a broad community and societal level, very severe misunderstanding of what actual child sexual abuse looks like, how it is carried out, who is at risk of experiencing it, and who the perpetrators are. So as primary caregivers to children, it is essential for adults to understand the dynamics of child sexual abuse. As A2A emphasizes, it is not on youth to keep themselves safe, right? This is adult responsibility. We need our larger community to understand this issue. So it is our responsibility as adults to engage other adults, other peers in our community and within our networks to create a culture of prevention, as well as to speak to the children in our lives in an honest and appropriate way about sexual abuse. Adults also need to emphasize that abuse is never the fault of the victim, and that survivor responses to abuse are always valid. So by normalizing responses and providing a safe and secure place to disclose, adults can better support child sexual abuse survivors in their lives, promote a culture of greater awareness, and with greater capacity to recognize, intervene, and ultimately prevent child sexual abuse from happening in the first place.
So this concept focuses on those general safety and situational awareness skills, general safety recommendations, teaching youth how to recognize safe and unsafe situations, identifying trusted adults and developing those support networks, and teaching youth self-protective skills and strategies. I jokingly kept referring to this section as like self-defense skills for kids, but that's not really what it is. It's much more useful than that. So research shows that youth who learn these skills are better able to recognize and respond to unsafe situations and to make safe choices for themselves. Crucially, these strategies are more effective when adults in their lives are supportive of these skills. So again, thinking about you taught them the skill, but do they actually have the power to use it? And have you made it clear that they have permission to use it? That's what you want them to do. Parental knowledge was found to be a really significant factor in whether or not children chose protective behaviors, presumably because those behaviors are then being reinforced at home. They're having conversations about it. It's also important to consider, once again, that role of children in society. Think about the messages that they receive when they speak up, how you respond to that. We need to take into consideration that children are brushed off by adults a lot of the time. So that's part of this, is teaching skills on how to communicate in a way that adults will listen. We shouldn't have to do that, but life is busy and adults have a lot of things going on. And sometimes it's hard to clock that the thing your kid's talking to you about is really important. So skills like telling adults repeatedly if the first person doesn't take action, and also remembering the piece of equity that is not necessarily giving everyone the same thing, and keeping in mind that gender socialization comes in here too. Other systems of oppression as well may impact a child's ability to acquire skills in this area. Girls are socialized to be more agreeable and submissive, which can sometimes result in them feeling less comfortable with assertive communication.
All right, we just threw a lot of content and information at you, both about what's in the curriculum review itself, as well as the content, the meat and potatoes, so to speak, of the 10 core concepts. What we're going to do now is talking about actually using the tools. So whether you're a teacher or you are a SASP prevention coordinator, whatever your role is, we want to talk about how these tools can be useful for you. We have two sort of scenarios to walk you through. So bucket one, if you will, if you're a person who is choosing a curriculum. So maybe you're a local program who is trying to decide what curriculum you're going to take to schools that you are invited into. Maybe you are a school administrator, a member of the PTA, a teacher who is involved in making a district-wide decision on what prevention curriculum you want to implement throughout your elementary schools. Regardless of what hat you're wearing, let's talk about how these tools can be useful to you if you are the person who is selecting the curriculum to serve youth in your community. The thing I want to make sure is really apparent to folks, especially if they are new to prevention. First, if you are trying to select any kind of prevention curriculum, we really highly encourage you to get connected with A2A and or us at WCASA. We would love to walk you through those steps, really how to use these tools more in depth, and also just establish a one-on-one relationship so that we can follow up and hear how your programming is going. Make sure you have all the support and resources that you need. That's what A2A and WCASA is here for. We will also really encourage folks who are new to prevention to start with a curriculum review. Familiarize yourself with common popular curriculum options. So what are the titles and programs that people are using? Let's see what's really popular, what's accessible, what's within our budget, what's free, right? You can compare existing curriculums with the curriculum review matrix, and you can really check the quality and status of the curriculums as evidence-based, evidence-informed, right? Which parts of the 10 core concepts are upheld and represented in this curriculum. So really utilizing that review as a place to sort of start and familiarize yourself with the widely accessible options that we know a lot of schools and local programs are using. We also highly encourage you to utilize the 10 core concepts to educate yourself on key concepts and content that makes curriculum really high quality, right? So if you're brand new to prevention and you're not sure what are the key components that we want to make sure high quality curriculum and programming is utilizing, how much of the 10 core concepts are represented in this program that I might implement, right? Do we see concepts and ideas about boundaries, healthy gender socialization, comprehensive sex education that's age appropriate, right? Do we see those concepts represented in this programming? Because if we're not familiar with these concepts ourselves, we really want these tools to become a way to build that confidence in yourself to make a certain to make a certain confident decision in the curriculum that you select. Also, something we want to emphasize that if you're new to prevention or, excuse me, a prevention veteran, maybe you've been doing this for a long time, you're familiar with the curriculums, you're using the review to sort of refresh yourself, the 10 core concepts to refresh your knowledge. Whether you are brand new or a veteran, we want to make sure that you are proactive in including your community in the selection of the curriculum. Megan touched on this when we talked about adult responsibility in prevention, and A2A is constantly reminding us that it is up to our adult decision makers to really keep youth safe, that we never want to place that responsibility on youth. The same sentiment is true in selecting the curriculum itself. We know that increasingly we've heard from both schools as well as local programs and SASPs that there is some hesitancy, lack of readiness in the local community when it comes to the introduction and discussion of certain concepts in the classroom. We'll be diving into those a little bit more momentarily. A really great way to proactively prepare for this, and I would say get around it, to navigate it with good faith, right? Transparency, is include the community as much as you can in your selection process. So make sure that parents are involved in the curriculum selection process. Make sure that they're aware of the curriculum in advance, right? Whether that's through sharing a participation note in advance, inviting them to listening sessions, helping them to feel included in the process so that they know what their kiddos are going to be learning, so that they understand it and feel supported and secure in the content that you will be delivering. We really encourage you to use the curriculum review and the core concepts to educate your partners and your community members on the quality of the selected curriculum. So feel free to use these tools as a translation resource for you when you are trying to bring parents or partners sort of up to speed on, this is why we know it's really important for your kindergartner to use medically accurate terminology, anatomically correct terminology when we're talking about their genitalia, right? See, here's this great resource that shows us why that's actually really important and isn't inappropriate. Here's why we want to make sure that we are talking about healthy gender socialization, right? We have this curriculum review, these 10 core concepts that provide that evidence and data for us, and we can use it to help translate these concepts and make it accessible to the community that we're going to be serving, so that adults, parents, teachers, right, everyone is sort of bought in, on the same page, and ready to receive and help you in your implementation.
One thing I'd add to that is we hope you use the curriculum review and look at the 11 curriculum that we were able to access. And quite honestly, we couldn't get our hands on every available curriculum. There have been new lessons published since we completed this review. So just keep in mind that if you're starting from scratch, have no idea where to start, this is a good place to start. And that scoring tool is in the curriculum review. And we'd be happy to help you look at if you find a different curriculum that wasn't part of this review. We encourage you just don't stop with the information that we give you. We always want to keep expanding that and would be happy to do that alongside you. So let's shift a little bit, and let's say a curriculum has been selected and now you are the person who's being asked to implement a chosen curriculum. So maybe you are a prevention educator, maybe you are a teacher, maybe you are a school social worker. Whoever you are, someone thinks that you are the right person to deliver the curriculum to the students in your community. So the first thing that we encourage you to do based on, those things to consider when implementing a curriculum is to reach out for support. You are more than welcome to connect with Awareness to Action, with WCASA, to first of all start with that capacity building. So for you as an educator to become familiar or re-familiarize yourself and be comfortable with the topic of child sexual abuse. We want to be able to prepare for disclosures of abuse and how to respond and how to report. Again, knowing that you're probably going to be in the context of a large classroom setting, so this might look really different than a one-on-one disclosure or something that comes up in an individual conversation. We would be happy to support you with considering what's needed to make a trauma-informed approach with students and families, and also think about how you might be impacted as the facilitator. We know that we all come with different experiences and different lenses, and that is true for you as the facilitator who will be bringing this information to your students. We also encourage you to see if the curriculum offers a facilitator or organizational training. So that's something that you can check in the curriculum review if you're using one of the 11 selections that were available. If there is a facilitator training or an organizational training, I strongly encourage you to take it or advocate for that to be added on if it's an additional purchase so that you can be fully equipped to deliver these lessons. We also, like Sarah said, you can use the tools to gain community buy-in, and we would be happy to support you with that as well. As we noted, prevention isn't going to happen if we solely focus on individual kids protecting themselves. And so use the information about prevention in the curriculum review and the 10 core concepts, not just to build your understanding and support your facilitation, but so that you might be able to advocate that things shouldn't end after the 1 or 2 lessons or 8 lessons that are offered throughout a school year. What I would encourage you to consider is that most people are going to agree that child sexual abuse needs to end. And so prepare yourself to advocate for that fully and not just on that individual level. And then the third piece is reach out if you have questions about or need assistance with adapting a curriculum or think that curriculum adaptations need to be happening, or so many variables. If you're being asked to adapt a curriculum and you're not sure if that is going to maintain its evidence-based status, or if it's really going to give the students what the curriculum is intending. There might be times that adaptations are needed and are fully appropriate, and there might be times that it actually helps it meet the needs of your community more. But ultimately, our goal is that programs are staying to fidelity and being improved upon rather than being I'm going to use the words watered down for lack of better terms, but kind of pulling pieces that are making it less comprehensive than it's intended to be. And Megan's going to talk more about that in a couple of slides. So that was kind of things to think about. Maybe if you're new to prevention or you need some refreshers, but if you're anybody who's being asked to implement a curriculum, use the review to check if the selected curriculum first is in the curriculum review so that you can familiarize yourself with what's included in it. If you're noticing that the curriculum you're being asked to use is not meeting the 10 core concepts, or in those notes there's some concerns, maybe it's time to reevaluate which curriculum is being used, and you can use that to ask that question. And again, if your curriculum is not in the curriculum review, you can use that scoring sheet to kind of do a self-evaluation of what's going to be included in this curriculum overall. Again, gaining community buy-in is so important. Gaining community interaction to be part of prevention, not just to say, yes, we agree with this curriculum, but here's how else we can be involved. So think about that primary, secondary, tertiary prevention. Think about the individual, the relational, community, and societal factors, and really use what's offered, including this webinar. This will be recorded, so you can share this to be sure that we're not stopping at that individual level. But now I want to pass it on to Megan to talk more about adaptations. And I just want to note that this is actually not included in the curriculum review. This is a bonus for you all today. So if this is information that you want access to or need us to spend a little bit longer on the slide, please let us know.
Yes, thank you. Yeah, I got carried away while we were working on the slides and ended up creating an extra resource. So I took this comes from CDC's reproductive health programs used a resource from education, training, and research. They developed that for their project that showed green light, yellow light, and red light adaptations. This is just a way to talk through what adaptations may or may not be appropriate. And adaptations are any changes to a curriculum, if you're not familiar with this term. Modification, removal, or deletion of any content, activities, things like that. If you think of the curriculum like a recipe, all of the active ingredients, the order of things, the time that you cook for, all of those things can be modified in some recipes, but can't in others. And there's often things that you absolutely shouldn't change, or things won't turn out the way that you wanted to. So adaptation serves a really important purpose. It can help us meet our audience where they're at, but everything that we talked about today related to evidence-based kind of goes out the window when you start adapting. Evidence-based programs, as my colleagues mentioned earlier when we were talking about the evidence-based program versus evidence-informed, when you adapt really in any way, it gets downgraded to evidence informed because it hasn't been rigorously tested in that exact setting. Your audience and the space, the age, everything about your audience is also one of those active ingredients. So that being different is enough that we need to go back and do more research to determine that it's evidence-based, that it's still an evidence-based practice. That doesn't mean that we can't do it. That doesn't mean that we can't make adaptations, just that we need to be thoughtful about their impact on our overall program. And we need to have more knowledge and understanding of the mechanics of the program in order to know what adaptations are okay. So I've made some adaptations to this red, yellow, and green framework to help it fit our topic better, as it was about reproductive health before and kind of focused on condom usage quite a bit, understandably. That's the thing that they're often getting pushed back when they're doing sexual health education, that folks want them to cut that. So that was very clear in this. And I kind of swapped in some sexual violence related content, and we'll talk about that too. The link at the bottom there provides some more context on this additional framework, just for you to review later. I'm not going to share it in the chat because I don't want you to get distracted by it right now, but it'll be in these slides when you get them later, so you can take a look if you'd like to know more about it. And it gives some more detail on some of the bullet points that I'll talk about too. But again, it's important to have a knowledge of behavior change theory and the curriculum, the theory behind the curriculum, in order to make these kinds of changes. As you can see here, the green light adaptations are generally considered safe and encourage changes that can help your program be a better fit for the needs of your audience. Most of these are going to be totally cool. We'll talk about them on the next slide. There are things that that most folks can make the adaptations for. The yellow light adaptations are changes that you should be cautious and thoughtful about making, and only make them as they are appropriate. So you need to have that knowledge of the change theory behind the programming in order to determine what pieces are active ingredients that you absolutely need, which ones are a little flexible, and which maybe you don't need. But the third category, the red light adaptations, generally are not recommended. We'll talk about those more later, but they should be avoided because they compromise and undermine the core concepts of the curricula. Here we have some examples of green light adaptations. Nothing distracts an audience of youth like a VCR in a video or some other form of outdated technology for them to mock, or ridiculously outdated language like sending an IM to a friend on the home computer as like you'll end up having a conversation with the youth about what is an IM and not about what the IM conversation was about that you were trying to teach. So swapping in language to be updated for the times, changing examples to more accurately reflect the lives and community of your audience will help them focus on the skills that they're learning rather than getting distracted by the pieces that don't fit their lives. These are often like for like swaps that increase the relevance for the audience. Things like changing out a beeper for a smartphone, changing out names to be more culturally relevant, and changing language to be at a different reading level. Here we have some examples of yellow light adaptations. The yellow light adaptations may be appropriate sometimes, may not be appropriate at others. So to make these adaptations, you need to have a strong understanding of the program's theory of change, the purpose of the piece that you'd like to adapt, the active ingredient that you want to change, and how that piece fits in with all the other pieces. This is a lot to keep track of because as we talked about today, some of these concepts really reinforce one another. So you have to dig into the research to determine if these swaps are okay. That might include doing research on your own, or it might be consulting with other experts. And ideally, if you're making a change that's in this area, you would want to pilot it with your audience if possible to test it out too. So paying attention to the evaluation results the first time that you do these changes, even if you've done all that research on the front end, if you notice that they aren't getting a concept that they were with the other example that you had in there before, you should consider switching back, or if there's a different adaptation you want to make, depending on why you're making the adaptation, which we'll also talk about that. There are some adaptations that we're going to make for values-based reasons or other reasons that that kind of supersedes other things that we're talking about. So on this slide, you'll see examples of all of yellow light adaptations. Most of this model is about the overall structure of the curriculum, but the original resource was specific to sexual health. So I swapped out the bullet point that was about the concepts that were most important in the curriculum that they were talking about to point to the 10 core concepts as a whole. Depending on your goals, you might have specific core concepts that fit in a similar place of modifying the content being a yellow, and then we'll talk on the red one about removing the content being a red. That said, you need to be that you have to understand the mechanics of your curriculum. Very few of the curricula that we look at covers all 10 concepts, if any. I don't think any actually really appropriately cover all 10. So that's normal. You can address all 10 concepts using different strategies, but knowing what core concepts are critical to yours is important. I tried to put these on a bit of a scale for you. The further down the list it is, the more likely it's a no for me. So for example, in many contexts, adding activities or additional content is going to be totally fine as long as you have time for it and it doesn't conflict with anything else that you're presenting. But it might not be if you're already tight on time and you're not sure if it'll leave enough time for everything to sink in, or if the concepts are being taught conflicted with one another in any way. On the other end of the spectrum, modifying content related to the 10 core concepts is something that requires much more thought and expertise, like we just talked about. You need to consult that research and potentially experts to make that modification, and you have to make sure it's still aligned with the goals of the program and still teaching the concept in alignment with research. Context, what the changes are, and the goals of the curriculum are all relevant here. So to give you an example, one of the curricula that I reviewed that I overall very much liked was Second Step Child Protection Unit. It's a very well constructed curriculum, and I've been told that some of the newest editions do not have the example that the newest editions do not have the example that I'm talking about. But we don't always get the benefit of having the newest resource in nonprofits. We know that. So this curriculum is pretty solid, and the first example that I came across that I came to when I started reading it was building off of safety rules with rules that are familiar to youth. So what safety rule did they choose to focus on in the first activity? The safety rule is about never touching guns. And it's a picture of a child holding a gun. Actually, it's a Black child in particular. So we're reinforcing some bias too at the same time. So right off the bat, that is something that I would want to adapt. I don't think that we need to bring gun safety into this conversation necessarily when we have other examples that are less scary situations for youth, as well as if I did feel like we wanted the gun safety piece in there, maybe we're presenting to local hunting clubs, like they have their kids there they want us to do a training that's talking about violence prevention in general, so they want us to talk about gun safety a little bit. I might leave that example in. I don't think I'd use the picture that they provided. I don't know that we need that part in there. And I think I think that reinforcing that stereotype is damaging in ways that aren't outweighed by the benefit of having a gun safety conversation. Unless, I mean, I still wouldn't use that. But again, I would remove the gun safety example completely unless that is also a core concept that we're trying to drive home. So remembering that like for like aspect of the successful adaptation, consider the purpose of that initial example. We want to make sure that youth understand the concept of a safety rule by drawing on one that they already know. So this means that you can choose another safety rule that they already know. And in the newer editions of this book, this curriculum, the safety example they use is about petting a dog that you don't know. It's about how do you know if you can pet this dog? You ask their owner if that's okay. You check with your parents, that all those things that most youth have experienced. So really what we want from the safety example is for it to be a rule that they know. And in the best case scenario, it's one that they've had an opportunity to practice. And most youth have spent time around a dog. And next, red light adaptations. So these should be avoided. These aren't in any particular order, as none of them are recommended. I do want to name that many of these things we are asked to do often. And I know some of us do acquiesce to do so that we are able to get some education to the youth in our communities, even if we know that it's incomplete, right? Everyone needs to make their own choices, of course, but these are changes that put us in the danger zone of nullifying the evidence behind the curriculum completely. So it's important to be mindful of the concessions that we're making and thoughtful about the impact of the adaptation we make on the programs, on the overall program impact and outcomes. So sometimes we do have to say no and find another place to reach youth if we're getting pushback in certain areas. Like I think that using my recipe metaphor for you, shortening a program, I can't cut the baking time of a cake in half and still give you a cake. It's going to be a sloppy mess. I might be able to make you cupcakes or something else smaller, something that bakes quicker. So maybe we focus in on just one of the core concepts, or we focus on a specific area. And I know that you're going to cover the other things somewhere else. We've made plans for that, but we focus because you only have this much time available to you. You focus in on what you are able to accomplish in that time, rather than trying to squish down a longer program to the point that it's not going to have the desired effect. I want to highlight too, again, that point about the 10 core concepts here, just to point out that again, you might be focused on specific ones. There might be some that are yellow light for you that aren't related to the core mechanics of what makes the program work, but are important for child sexual abuse, that you want them in there. So it has to be thoughtful if you're removing it. But there should be some that are absolute no-goes. You can't just remove the content and have it continue to work. Yeah. So when making those adaptations, you should be able to identify which core concepts are essential ingredients for your program to work and which are just gravy on top. So removing the gravy is more of a yellow. The red is when we're trying to make mashed potatoes and we forgot to get anything to mash the potatoes with. So if you mess around with those core ingredients, things won't turn out right. And we want to make sure that we're making the kind of choices that respect and keep the mechanics and evidence behind the curriculum working as they're supposed to. And then I did want to briefly just share links to the resources in here and plug the WCASA prevention page. I will share the prevention page in the chat, and you can find both of those resources there as well. And the slide has those direct links to the 10 core concepts and the child sexual abuse prevention curriculum review. Sarah, Laura, do you have anything to add?
I don't have anything else to add. I love that piece on the adaptations, Megan, and I feel like that's a great tool that I hope we can continue to expand and really pull into our resources and our TA delivery. Thank you so much for going over that.
Yeah, I think I'd like to build that out more. So if that framework seems helpful to folks, that would be great to hear about, because I would love to know how to make it more useful for people.
With that, thank you so much for your time and your attention. I have our contact information for all three of us here, both how to get in touch with Laura and Megan and myself. We'll hang out for questions if folks have questions about the tools and resources themselves, about Megan's information on adaptations. And otherwise, you are welcome to go. I'm happy to give you back 15 minutes of your afternoon. For folks who stayed, thank you so much. We really appreciate your time and your attendance. I will stop sharing.